Ryan, and this is a Facebook Live on proline-rich polypeptides, PRPs, and how they can help with brain function. We're broadcasting live from, well, you're over here, right? We're broadcasting live from northern Italy. That's why it's on Wednesday this week instead of Tuesday, because I was traveling yesterday to get here. It's beautiful here. I'm really grateful to be here. Hope you guys are doing well. So let's start by talking about first the aging brain. And what is it that we see with an aging brain? What scientists now know is genes. You know, if you think about our genes, what do genes do? Genes turn actions on and genes turn action off. The action you turn on or off determines what your cells are doing and what kind of function you get. So I want to show you a picture because this is so cool. I'm hoping this is going to show. This is my computer, and if you see the screen here, see all the different colors, and reading from my left to the right, this column here going up and down, this is a 26-year-old brain, and at the other end, it's a 106-year-old brain. So they looked at genes that get turned on all through life. And if you notice that at my left side, mostly the red genes are turned on, not too many of the blue ones. The red genes are the genes of the brain that are activated for better brain function, anti-inflammation, calming things down. All the way over to the 106-year-old, you see that the majority of red genes are up here, but mostly at the lower, maybe 3/5 or so, those same genes that were active in the 26-year-old are now blue. They're not so active anymore. What this shows is that the degeneration of the brain, what genes are turned on, what genes are turned off as your brain ages and as it degenerates. And the goal is to have more red genes activated. This lower part, as in the 20-year-olds, when you get these genes that stay active through life, your brain cells are more vibrant, they produce more energy, you've got better retention, you remember more. There's a term called plasticity. It means adaptability. You've got more plasticity when the red genes are turned on. The aging process turns off the genes for vitality and turns on the genes for senility. And we don't want that. As much as possible, we don't want that. You know, there is a normal aspect to aging, but we want to slow down that aging process. Oh, hello, Sue from Melbourne, Australia, and Hubert in New York. Thank you. Thanks, Hubert. Yeah, it is a great way of seeing that picture. Thanks so much for that. So the goal is to keep the genes activated that are for plasticity, for adaptability. That's why blueberries are so good for you. You may have heard me say in the past that 1 cup of blueberries a day, every day, within 3 years, demonstrates a reversal of brain function as you were 13 years ago. In other words, your brain's working like it's 13 years younger. 1 cup of blueberries a day. And why is that? Well, it's because blueberries turn the genes on to maintain neuroplasticity, to maintain the adaptability of our cells. How do you get a cup of blueberries a day? Well, for me, what I do is I buy them frozen. I buy organic every chance I get. Oh, thanks, guys, for all the smileys. Thank you. So I buy organic, and then as a result, oh, the camera's over here. I'm looking over the other side of the phone, so you're over here. Thanks so much. Thanks, honey. I buy frozen organic blueberries, and I put them in a smoothie. That's the easiest way. There's lots of benefits to having smoothies, guys. You can do it with a blender. I've been doing it with a little handheld blender, and I've been using a mason jar because the blender broke and I don't have time to go get another one. So I've been doing it mason jar, handheld blender, just throwing everything in there, zooming it up. I put bee pollen in there. I put colostrum in there. I'll talk about colostrum today. I put some protein powder. I use a collagen, organic collagen protein powder. I put, what else did I throw? Oh, seeds. I take flax seeds, pumpkin seeds, hemp seeds, and sesame seeds, and I put them in a little coffee grinder to go, and then I just put them in my drink. Now the coffee grinder, when you break them up like that, oh, chia seeds also, chia seeds, and when you blend them up like that, you release the oils. That's why you don't want to buy ground flax seed. You want to buy fresh flax seeds and grind them yourself, because within 4 hours, when you grind flax seeds, the oils, because they've been exposed to the air, the oils oxidize. What does that mean? It means the oils aren't so good for you, nowhere near as good as they were before. There are more inflammatory markers with ground seeds after they've oxidized. And you can tell, you know, if you take some, just take some flax seeds, put them in a little coffee grinder, grind them, and just taste them, say, oh, it tastes okay, but leave some, don't eat them all. 4 hours later, taste them again, and say, well, I think that tastes different. And if you're not sure, grind some fresh ones, and then taste the fresh ones, and then taste the ones that have been sitting for 4 hours already ground. And you'll be able to taste the difference of what oxidation does when oils are exposed to the air for a while. That's why I grind my flax seeds fresh when I'm putting them in the drink, in my smoothie. And that's where I put my blueberries, is in the smoothie. And that's why blueberries work for you, is because blueberries turn the genes on like the 26-year-olds, that you keep those genes working throughout your life to a higher degree when you eat a couple blueberries a day. So that's the reason why blueberries are so good. So our goal here is to keep a healthy brain, because I fervently believe that you should be able to learn a new language in your 80s. You know, when we did the Gluten Summit, and it's so very cool, I'm still so very proud of it, glutensummit.com, you guys will see it there, glutensummit.com, I interviewed 29 of the world leaders about wheat sensitivity and gluten sensitivity. I assume a Vitamix would grind them as well in a smoothie. I don't know, Diane, that's a really good question. And Marzi is sitting here saying no, she's just shaking her head. And Marzi's a nutritionist, you know, so she doesn't think that the seeds get ground up in a Vitamix the way they do when you just grind them in a coffee grinder. Hello, Tony from Southern Ohio. Well, that's not too close to that place in Ohio that I don't know how people can survive in. They call themselves Buckeyes there. And you know, I'm from Ann Arbor, Tony, so we've got this little thing about some people from Ohio. But I'm glad you're from Southern Ohio. So no, I don't believe that Vitamix, but I'm not a Vitamix expert, but I don't know for sure. But Marzi says no to that. So, you know, a little coffee grinder, you can get one for $12, $15. Doesn't have to be really fancy. I just have mine sitting on the counter. I've got one for coffee beans, and I have another one that I use for spices. And that's the one I put the seeds in, is the one for spices. When I put spices in food, I put them in the coffee grinder first, and then pour them on my food. Why? Because you're opening up the oils of the spices. You know, these spices you buy in jars, they've been sitting in that jar for months and months and months, right? So how do you get them a little bit fresher? And that's what I do, is I throw them in the little coffee grinder thing and do that. Okay, Joan, pansies are maize and blue. Okay, well, get over here, Joan. That's really cute. So that's the coffee grinder thing. But blueberries. Blueberries will turn genes on for neuroplasticity, and what that means is adaptable brains, brains that think more, brains that, and once again, 1 cup of blueberries a day, when you do that for 3 years, you reverse cognitive decline of up to 13 years. And why does that work? Because you're turning on the genes. So let's get back to the genes thing. So our goal is to keep the genes working for youth and vitality in the brain, and slow down the turning on of genes that cause senility and lack of function. And those genes that become more dominant in the older people, see, the goal is, if you notice where I have the yellow circle, that's middle age. That's the transition time when you're determining on a daily basis what genes are turning on, what genes are turning off. So that's the time when you really have a lot of, I guess I would call it the age of influence. During these ages is when you have the ability to make big changes in brain function by turning on the different genes. And one more thing I'm going to point out here is that you can see it goes from, so what we want is red. We want the ones in the lower part of the screen to stay active, like the 20-year-olds, and not for them to go inactive like the 100-year-olds over here. So this middle stage is where this happens, where that transition's occurring, and that's when you have the greatest sphere of influence. You know, I don't know this, I'm just assuming that the studies that were done on blueberries were not done with 20-year-olds because their ages are not in a state of cognitive decline. Well, you know, some 20-year-olds, you see how they live their lives or how they think, and you think, boy, those genes aren't working very well for thinking. But in general, it's the Middle Ages when you have the greatest sphere of influence on which genes you're turning on, which genes you're turning off. So I want to talk about one product that we've been using for years, and there are hundreds of studies on it, and that's called proline-rich polypeptides. Proline-rich polypeptides, or PRPs. I'm going to talk to them as PRPs. What are they? You know, colostrum is the first 3 days of mother's breast milk. When a baby is born and mom starts feeding that baby, mom is not feeding that baby breast milk. Mom is feeding that baby colostrum. It's not milk, it's colostrum. It's got a number of functions. Just found out Dad just died at 81 with Alzheimer's. Love this info. Hey, Jeej Van Ark says, I'm ApoE34, just found out Dad just died at 81 with Alzheimer's. Love this info. Thank you, Jeej. Yeah. My family is 3/4s. I'm a 3/3, but my family is 3/4s. And what that means is that for you, it's a weak link in your chain. Remember, you pull a chain, it breaks at the weakest link. It's at one end, the middle, the other end, your heart, your brain, your liver, your kidneys, wherever your weak link is. When you have a 4 in the ApoE genes, you get one from your mother, one from your father. They only can be a 2, a 3, or a 4, so it's 2, 2, 2, 3, 2, 4, 3, 3, 3, 4, or 4, 4. If you've got a 4, you're a little more at risk. It means that's a weak link in your chain. So this information is really critical for you, and you're the type of person, and we'll do one about ApoE4s. We'll do a Facebook Live on it, because I've got a number of patients that are 3/4s or 4/4s, and there's a sequence of what you have to do to maintain keeping those 4 genes quiet. They're the ones, those people that have the 4, the weak link in their chain, is towards greater senility, more activation of the genes for inflammation, and more, it's called oxidative stress. Not as many genes for plasticity or adaptability. That's the vulnerability. It doesn't mean you're going to get that. It's really clear. It doesn't mean you're going to get that. It means that you're vulnerable to getting that. So you learn the biomarkers of how to keep your brain young, how to keep the red, in this graph, the red genes. You know, this is such a great picture. I just keep going back to it. You want these genes down here in the lower half to stay active through your entire life. If you have a 4, there's a tendency for these genes of plasticity to get turned off and genes of inflammation to get turned on. You have more of a vulnerability for that. Doesn't mean it's going to happen. Means that you're vulnerable to that happening if you pull at the chain too hard. It's really important to get that, guys, because that's true for all of us and our genes. Oh, hi, Tommy. Glad to see you're here. And hello, Sherry from Iowa. Hello, hello. So we want to turn the genes on for plasticity, for adaptability, and that's all the nutrition, everything that you hear about that can be helpful is because, with brain function, is because they activate the genes to protect you. and calm down the genes of inflammation. That's the goal here. So let's talk about colostrum. Colostrum contains the ingredients called proline-rich polypeptides, PRPs. And one of the things that PRPs do is turn baby's brain on. Say, okay, baby, you're out in the world now. Let's get some of these genes going to start processing a little more, processing information, get aware of your surroundings a little bit more, then start processing this information. That's the PRPs turn those genes on to adapt, the genes of neuroplasticity. And so what researchers started doing way back in the 80s is they started extracting some of these peptides of colostrum and concentrating them. So as opposed to having just a little bit of these peptides available, they extracted the peptides from colostrum so there was more of them and started giving them to animals to see what they find. And what they found is these animals, their brains stayed young, that as they age, they didn't slow down. They didn't act like older animals. You know, they were peppy, they were alive, they adapted, they put them under stress, they handled the stress better when they were using PRPs. So they started, once they determined they were safe, they gave them to adults also, humans, and what did they find? The same thing. Now this is what's so very cool. In the Journal of Alzheimer's Research, there are a number of studies talking about these proline-rich polypeptides, these PRPs, and keeping the genes active for neuroplasticity. And they say in some of these studies that say that they've slowed down the progression of Alzheimer's, and other studies they've arrested Alzheimer's. Arrest means you stop it with PRPs. And why doesn't the whole world know about this? I don't know. There's no real profit, I guess. You know, a pharmaceutical company can't patent it and make profit from it, so there's no big push out there. Just go to Google and type in PRPs and brain function, or go to my website, and we'll throw some links up here for things that you guys can look at, and look at PRP and brain function, and you'll see it's an OMG. You say, oh my God, look at this. Look at these studies. So that's great. So PRPs, and we're putting the link in here so you guys can take a look at them. I see there's how many sprays should you take and for how long? Hi, Terry. That's a really good question. 2 squirts twice a day was a standard dose that they were using in most of the studies. Sometimes it was 3 times a day, but 2 squirts. And it comes in a convenient little size. I don't know, it's a couple of ounces. I'm not sure. I haven't read the label in a long time, but it's a small bottle. And you travel with it. It's TSA friendly, so you can carry it on a plane. And anytime you've got, how do I recommend it? Anytime you've got something going on with your head, if you've got sinus problems, you can use the PRPs because they help your immune system. They activate the genes to protect you. Vision problems, hearing problems, thinking problems, kids with attention deficit or autism, it's great to use them. What about, if they come from dairy, what about for people that have a dairy sensitivity? And that's a really good question. And this is what I've said for years about colostrum and also about PRPs. Mrs. Patient, you've been dairy sensitive for years. We just found out recently. So we're going to get dairy out of there. But let's try for a couple of months to use the colostrum to heal the gut, or in this discussion to use the PRP sprays to help you with brain function. Let's try it for a couple of months and see how you do. If you have any symptoms whatsoever, stop right away. Stop right away. So get the milk out, get the cheese out, get the ice cream out if you're sensitive to dairy. But let's see if your body can use these PRP sprays or the colostrum powder for a couple of months, because they turn on so many genes like nothing else does. And these PRP sprays turn on a horde of genes in your brain to help your brain function better. That's the goal of the PRP sprays. So this will be archived to view later, having trouble with it. Yes, Jay, it will be archived. And thanks, Brad West, for your comments. So let's try, Mrs. Patient. Let's use it for a couple of months. And no problems if you don't get any congestion, you don't get all plugged up, because some people with severe dairy sensitivities, they will, but most people don't. And so I think it's the lesser of two evils, if you will, that if you have a dairy sensitivity, get all the major sources out, use the colostrum or use the PRP sprays for a couple of months, and as long as you don't have any symptoms with it. And I've had a couple of people that did get congestion, and it was like a nuisance for them, and that, okay, it's okay to stop, Mrs. Patient. It was worth a try. Let's see, try it a couple of months after, just keep it in the refrigerator, so it'll last you for quite a while. And it doesn't have to be refrigerated all the time, folks. Once you start using it, it'll last you for a couple of months just fine. But if you want to extend the shelf life, just keep it in the refrigerator, and that'll help. So, Mrs. Patient, if you're having a reaction, just stop taking it. Wait a few months as your body gets stronger, and then let's try again and see what happens. Okay, yeah, a couple of people said they had problems logging on. So yes, this will be archived, and you can go back and look at it again. The goal here, guys, this is the goal. When you want better brain function, that was the wrong slide, there we go. When you want better brain function, you want the genes that are just like the 20-year-olds, that's over on this side. You want them to stay active longer. You don't want the normal transition. What is this graph? This was done at Harvard, and they just measured what genes are turned on for people and at what stages of life. And these are the genes in the brain. And if you look at in the old people, there were some people that were in their 80s and 90s. They still had a dominance of the genes for plasticity and anti-inflammation. So these aren't people that were going through treatment protocols. These are just to see what genes people turn on, what genes they don't turn on. And so that's the norm. Now we know what we want is we want to keep the genes active that are active in earlier stages of life. That's the goal. Okay, if you have questions, put your questions down. We always look at all the questions. I try to answer them. My staff or I will try to answer them as best we can. We can't do diagnosis, on Facebook Live, but we can answer almost all your questions. And if you would, guys, please pop the little things, your little hearts or whatever on there, and please share this. My goal is to get this information out to the world, and I want to give you the bullet points, just the bullet points, the takeaways. So hopefully in this one you got the bullet points. I want to turn the genes on that were on for my brain when I was in my 20s. I want to keep those genes turned on. Oh, thank you for the hearts and all that. Thank you so much. I want to turn those genes on and maintain so that when I'm in my 80s, I can learn a new language if I want to. That will happen as you keep working those muscles of your brain to keep neuroplasticity. So that's the goal here. With that, I will say thanks so very much, and I'll see you next week. We should be back on schedule on Tuesdays next week at 4 o'clock Pacific, 7 o'clock Eastern. Thanks so much. Love to you all. Bye-bye.